Hi everyone, Dr. Vipul Shah here, Clinical Director at PAC Health. Here shooting from my house today because we are following the stay-at-home orders that are in place here in Alabama, and I'm sure they're in place in a lot of places where you are as well. So we hope you guys are doing all right. And this week's update is going to focus on mental health, and we're going to give you some strategies to cope with what's going on and for helping with your stress and anxiety during this really crazy time right now. A couple quick updates. You may have heard that the CDC has changed its recommendation regarding masks. So they now recommend that if you're going to be out in public, which you should only be out in public if you're going to the grocery store or the pharmacy, but during those times, in order to reduce the spread of the coronavirus, that you can wear a mask. They're not recommending using surgical masks because we still need those in the hospitals, but if you can make a homemade mask, that is now recommended. We have a great graphic on PAChealth.com that you can check out on how to make a really easy mask with the stuff you might have at home. Remember, this does not take the place of staying 6 feet away from people or washing your hands or avoiding touching your face. Those are all still very important. The other thing is there's some new discussions about new testing and new treatments that is out there. We have a blog post that we're talking about some of those on. Remember, all the treatments are still experimental at this point, so there's not been a tested treatment for COVID-19, but there is stuff in the pipeline. So let's get really into how do we manage stress and anxiety during this time. So what are some signs that your stress or anxiety is really causing some issues in your life right now? So some of the things that we look out for are changes in sleep patterns. So if you're sleeping more than normal or sleeping less than normal. Changes in your eating habits. So eating more or eating less than normal. If you're having really a lot of difficulty concentrating, worsening of your existing health conditions, or increased tobacco or alcohol use. Those are all signs that you may be under a lot more stress and that you may need other ways to help cope with that right now. So what are the things that we recommend here at PAC Health to help you deal with your stress? One of the things that you can do is, as we've been recommending from the beginning, is making sure you're giving yourself a break from all this news about COVID-19. It's overwhelming and it can saturate every moment of your life. So setting limits on how much you're checking the news, checking social media, and can be helpful. Also, making sure you stay connected to your friends and family via the many virtual ways that you can, but also reaching out to some of the support groups that you may normally lean on. So places like your church or your book clubs or friends groups or other organizations, like if you're in AA or any of those sort of organizations, they do have a lot of virtual options now that you can stay connected to and may be really important at this time. Take time for your hobbies, whatever they may be. If it's nice out and you like to garden, make sure you're getting out to your garden. If you like to read, doing things that normally would make you feel relaxed and happy and be who you are. Consider meditation or yoga or mindfulness practice. These are all well-established ways in which to help reduce stress and anxiety. So if you need any help with some of these techniques, PAChealth.com has some resources, as do many other places. So ask your health advisor. If you go to YouTube even, you can find some great yoga videos, and there's some great apps for meditation and for a mindfulness practice as well. Also taking time to manage your chronic health diseases. So making sure you do the things that we've talked about in our prior videos about managing your diabetes or hypertension or any other pain issues that you have, staying on your health plan that you've had. And also exercising. Exercising is a great way to relieve stress. It can help you get your mind off things, but it's also good for your body and your mind. And then eating healthy is important as well. And finally, of course, getting a good night's sleep. So practicing good sleep hygiene, meaning making sure that you try to get a full 7 to 8 hours of sleep a night, is important right now as well. If you need any extra help, make sure you reach out to your health advisor. We once again can help you not only with things related to stress and anxiety, but whether you need groceries or if you need help getting medications, we're here to help you. And I stress again, if you find that you're at a point where you're either feeling like you're going to hurt yourself or hurt somebody else, make sure you reach out to 911 or to one of the crisis hotlines and get help as soon as possible. As always, we here at Pack Health are here to help you do whatever we can, and stay safe during this time, and we'll see you next week.